you have any question. I think I'm going to start by answering the question that Obegeli asked me. Obegeli, the thing is that this country most times will always going to make you feel like you don't have NHS experience. Don't worry so much about it. Make sure that your profile, your working experiences are there. If you put it there, it is very rare for them to say that to you. Okay, so because when you say NHS experience, who are the people that work in NHS? They are biomedical scientists, and you're a biomedical scientist, so why won't you be able to work there? Okay, but what happens is that when we don't, one of the things I said at the beginning is that avoid being in a hurry when you are making. Many of us, we are just in a hurry to make application. Why are you in a hurry to make application? Instead of spending your time to make that application, send your application in such a way that for them not to shortlist you, there has to be a strong evidence not to do that. So if you now express yourself that way, that will be fine. If you're in Nigeria, if you're not in the United Kingdom generally, sometimes they may not shortlist you, not because you are not eligible or not because your applications are not strong. It could be because you are not in Nigeria, sorry, you are not in the UK. They know that if they shortlist you, you will not come face to face, and they prefer face to face, and that way they may just tell you are not successful. It's not because your applications are not strong, it's just because you are not in the UK. But once you're in the UK and you've done this thing that I've said, it is very rare for you not to be shortlisted. However, any organization that wants to do a virtual interview, irrespective of where you are, if you have done this thing, they will definitely going to shortlist you. Obegeri, do you think I've answered your question?
Yes.
Okay, thank you. So any other question? The floor is now open for you to tell me if you have any question. Yeah, Isaac, go on. If you want to ask a question, raise your hand, then I'll call your name.
Okay.
Yeah, and we'll say, please, thank you very much for this opportunity once again. My name is Isaac. I'm in the UK, currently in the UK right now. So far, I've made plenty applications. And so far, I've gotten like 3 interviews, and so far, all the 3 interviews are not successful. My question is, sometimes in the interview, one of the questions that they asked was, what is your IT literacy? I know I have knowledge in IT, but how to resonate my IT literacy to the laboratory IT is a challenge. And sometimes they also ask about one of the questions that they asked was maybe when there is a spillage of urine on the ground, or when there is a reagent, maybe the reagent has fallen on you, like as it has spilled on you. So what are you going to do? So those are some of the challenges that I faced during the interviews and so far. Yes. Thank you very much.
Okay, thank you. Right, I'm going to answer that question. Then after that, Babatunde, you can then ask. But let me answer this question so that I won't forget. One of the things I really want all of you to know is that most questions they ask you is not far from what you know. It's just that you are panicking. Just relax and think about it. When you talk about IT in the laboratory, what can you possibly use computer or IT to do in the laboratory? Is these limbs we are mentioning? So you need to know something like maybe your MS Word, like Microsoft or Excel, because sometimes there can be Excel spreadsheet in the laboratory. There are so many things we need to do. Okay, so you say I'm competent in the use of MS Word, such as maybe Microsoft Teams, MS Word, MS Excel, MXL PowerPoint, and all of that. And I'm competent in the use of a number of laboratory information management systems, such as that's IT. Okay, understand the implication of the interface between analyzer and the laboratory information management system. So you mentioned something like QPOS. If you know about QPOS, okay, so you can measure some of those things that are used in the laboratory. So QPOS is like a kind of environment, okay, electronic environment where the laboratory store a number of documents, like something like their SOP. So SOP can be hard copy, it can also be e-copy. So it is in a QPOS, which there are different companies as well, but the majority is a QPOS. They store those information there. So you just need to link it. That's what it's all about, okay? That laboratory information management, so your knowledge with the MS Word, your knowledge with the use of computer, okay, the typing and all of that, that is all you need to say, okay? Your knowledge with in terms of troubleshooting, analyzer, these are IT skills. So once you mention that, that is what it's all about. Now, when a reagent spill, you might think this is a big thing. Sometimes which I used to tell some people. I said, I think I heard a story of a professor was asked 1 + 1, what is it? That professor thought that a different answer was required. And that professor could not answer because he kept quiet, but a child just said 1 + 1 is equal to 2. Why did I make that joke? I make that joke because when they ask you this question, you know it. It's just that you thought that a different thing is required. If something spread, let's say spill off, let's say blood spill off on the table or whatever, what are you going to do? What you need to do is that first of all, you know, this area, if you go to the UK, you know that the common thing that they will put this sign of don't fall, slippery environment, you know, that kind of thing. You put the sign there. Once you put the sign there, if you are competent on how to wipe it, what do? You get disinfectant. In this place, they use what they call chemogene, or you can use any of the alcohol like methanol, as the case may be, and clean it. Or if you can call, what's it called, the cleaning department, they can come and use their skill and clean it. That's what it's all about. Okay, if it's spilled on a table, the same thing, use chemogene and wipe it, and make sure you dispose everything appropriately. Does that make sense, Isaac?
Yes, sir. Yes, sir.
Yeah. So what I'm trying to, the point I want to make here is that don't think a different thing is required. It's the same everywhere. The same way in your house now, if you spill something, the same way you clean it. The only difference is the style. The style now is you are aware of what that you need to use to kill the possible bacteria, the possible aerosols that thing may cause. So by the time you use alcohol to wipe it or chemogene, it will disinfect it. Does that make sense? So, for example, some of these questions can come in things like you cut your hand, or you mistakenly whatever needle or whatever thing, or you fall in the laboratory or something like that, but you're bleeding. What are you going to do? What you do is to call the person responsible to the first aid. So it's not that's just what it is anyway. Okay. If I've answered your question, do you think I've answered the question, Isaac?
Yes, sir. Yes, sir.
Okay, good. Thank you. So, Babatunde, you can now go.
Thank you, sir. Thank you for your time, sir. When I was in Nigeria, I was working as a biomedical scientist, but I relocated in October 2021 for a master's degree in hematology, where I graduated in October 2022. And since then, I've not been able to get a job. So I work as a support worker, healthcare assistant. Now, in the work experience now, whenever I see it, it became a challenge for me that what can I do in such a situation? Can I add support? Because I'm thinking if I should add supporting worker or healthcare to them, it might think, no, it doesn't fit the role, but they will ask that, do you have any gap in your employment history? So I would like you to advise me on this, on what to do.
Okay, that's fine. All right, that's fine. That one is just very simple. Let me just say this before I continue. Please, if you have not stayed in the UK very long, spend your time and learn the culture here. You see, this thing you said is not the way they think. No. It's not the way they think. Put that care job. Put what you are doing there. Put it. It shows that. Do you know why they ask for reference? They ask for reference because reference is not just about what you have done. It's about character. If you are working in a support work, that means you have a good character to be employed. Do you understand now? Okay? So you are the one overthinking. What you need to, that experience you have in Nigeria or wherever you are coming from, write it very well. Make sure that it is well, you feed that information very well. Once you have feed that information very well, come to your care job, still put that information. When you come to what you have done, hematology, masters and all of that, it can give you a lot. In fact, that will even give you more opportunity to say even what you have done in that university and also what you've not done. Say MSc in hematology, mention a lot of modules you've done and the things you guys did. You can from there bring in some of this information of what I am saying in on my YouTube that you have done, even though there's a possibility that you didn't do that here, but you can mention all of that, and that way it will not deter them from shortlisting you. Let me give you an example. I'm a lecturer now. I don't work in the lab. So are you trying to say that if I decide to come after 5 years and apply? No, you can't say For the fact that I've done it before means I can do it again. I don't know if that makes sense. Your own is to do your best, put it there, and make sure that the information you're putting is real. So I can bet you your challenge is not trying to avoid that you were a carer. No, that's not your challenge. Your challenge is that the supporting information and the working experience is not rich enough for you to be shortlisted.
Okay, sir.
Good. Now, and that is where I'm going to tell you, even when you come to the training, you are going to see that under the training, you mentioned a lot of the training that you've done with the support work, fire, whatever, all this training you guys do there. You can mention all of that in your training. This thing is CPD. So don't shy away from those things. We don't think like that here, believe me. No, we don't. What we do is that when you say what to look like, you know what to do, we'll give you opportunity. When your duty is that when that opportunity is given to you, how do you then present yourself? That's where the problem is. Does that make sense? Okay. Interview is an opportunity to invite many people so that the company can select whoever they think is the best. All right. Okay. I think I have two hands. Somebody, the first person that raised hand, I think was Sandra. Sandra, go on. Then after Sandra, Blessing.
Okay. Oh, thank you very much for the opportunity given me. First of all, I want to say my situation is really quite similar with what I'm about today. I've just talked about now. Presently, I'm in UK presently. I came in 2022 for my master's program. But while in Nigeria, I had the opportunity to get about 3 invites, which I attended to because the third one was, they said it's a face-to-face issue, so I couldn't attend the third one. Though I didn't get any of the job before I came in. So presently now, after masters and I switched to a work visa, and presently I'm working with NHS as an ACA, healthcare assistant. So since then, I've not been really getting invites, even though I've actually updated my SI, and I think my SI are still powerful, I don't know. So I'm not thinking probably the ACA is affecting me because I put my work experience in the ACA in my SI as well. So I don't know if it's my being an ACA now that is my problem. I don't really know.
Okay.
So what do you think? So I don't know if I should remove the ACA experience. I don't really know what to do because yeah.
I think that there is a mistake you made in your profile that you said now. There's a difference between saying I work as a care, something like this.
Healthcare assistant.
Yes. There's a difference between saying that in your working experience. You don't need to put it in your supporting. Supporting information is for what you are applying for.
Okay, fine. I didn't put it. It's only in my work history.
Good. So if it is in your work history, I don't think that is a problem. I still maintain that is not. It shouldn't be the problem. Let me tell you guys something. Maybe I should give this as let me give it as an advice now. I want you to know that there's a problem in the market. Because the problem in the market is that which everybody is looking for better life, isn't it? So before, when I came to this UK, you can go for interview and you're the only person. Are you getting me? Okay. In those days, maybe they shortlist too much. How many people? Even some people will even cancel in that morning. Do you get? So, but now, I can bet you that many people are actually going for that interview. Our brothers and sisters are here to attend, and that makes it very challenging. I'm not sure how your profile are, and I'm not sure if you've seen what I've presented, but if it is exactly like what I've presented, that means it's not a problem. What you then need to do is that there's another style. These are some advice I wanted to give towards the end, but let me give it now. When you don't have UK experiences, or when you don't have a UK experience, don't let the system to frustrate you. Take advantage that you are in this country if you are here. For example, don't apply job based on if you. That's what I tell people. There's a when I'm mentoring people, like I'm trying to do for you guys, I tell them be up to date on NHS profile or NHS job. What I mean by up to date, if you have not applied for all the job in NHS, you've not started looking for a job. You see, these people come and say, I live in Chester. I come and apply Chester, Manchester, looking for where it's close to me. No, you are not looking for a job. Okay? When you want to look for that job, you need to be willing to apply everywhere. Scotland, not just apply. Do you know what you are doing? As you spread it, there are people that when they see that you are this, they will give you opportunity. For example, if you apply in this area, maybe something like Chester where I live, there's a possibility that many people who have experiences are going to apply anyway. Are you for Sandra, do you understand what I'm trying to say?
Yes, I'm with you.
So these people are applying. Someone like me come and apply. How can they see someone like me and be shortlisting you? No, because I want you to think about it. I want you guys to know what you are doing. That's why I started by beginning. I say, you know, we are not. If you are very strategic, this is not a problem. Remember that I'm in a position where many people talk to me. I've helped many people. When I mean help, in fact, there is somebody that got job. Two. I have to tell her, leave this one, take this one. And this person that got a job, because of this is something I might put on the internet. There's something I'm not going to say. But this person, when this person came to this UK, whatever, you know, there is no job. So it's not like this person is even working. Are you getting me? But this person was supposed to do care job. Hopefully you guys understand what I mean. Okay? So now, but this person is not working. And the person will say, don't worry, bring your SI, let's tidy it up. Tidy the SI, tidy the experience, do it like this. There are many ones that didn't come, there are some that came, but at the end, the person got the job. The secret is that you don't give up and you must be up to date with the application. If there is advert today and you don't know, and until it expires, you not start looking for a job. Because if 100 people apply, and out of 100 people, they can see 20 or maybe 10 or 15 that are working in the UK or that has worked in the UK, why would they have to stress themselves? It's not because of if your SI is good. I made this point before, and your experience are good. Forget it. It's not because you are working as HCA. It's just that they've gotten, are you getting me? Enough people that are already working in the UK or has worked in the UK.
Yeah.
So your duty is to spread it. Because whether you like it or not, someone like me, there are places I wouldn't want to go in this UK, but someone like you might be willing to go there. Okay? So what you do, you spread it. There are places that people who have experience don't really want to go. You see it now? You spread it. And someone that has experience, like if I want to look for an NHS job, I can bet you, I wouldn't want to look for anything that is far from where I live. But for you, spread it everywhere. When they shortlist you, beg them for a virtual interview. If they say no, they want face-to-face, see how you can attend that face-to-face, because you never know the one that will work for you. Sandra, hopefully I'll be able to answer that question, right?
Yes.
Okay, blessing.
Yeah. Thank you very much.
Okay, Damilora, go on.
Yes, sir. Thank you very much, sir. My question is more of like just asking for an advice concerning those who are applying from Nigeria, because I think it's like an uphill battle, especially for those applying from Nigeria, because like we've seen here, we still have our brothers and our sisters and our friends who are already in the UK who are also applying, especially for institutions that want physical interview. And I think most institutions might want physical interview, and it might not necessarily be that the application is the problem, it's just the location. Like what do you have in terms of advice for us? Like what is it that we can do to up our chances, sir?
Okay, that's fine. I think I've actually mentioned that before. One of the things you do is don't be discouraged. Keep applying. There is always going to be, you don't know these guys, so there's always going to be this person. I'll feel like, I think this person application is good. Let's give him chance. Are you following? Then, but make sure you apply for all the job in NHS. If you are looking for, this is what I did, by the way. If you are looking for a job, you might apply for 100 and then maybe 10 or what am I even telling? Maybe 5 will tell you you'll be shortlisted. But what if you don't apply for that 5? And let me say this, you don't need many interviews shortlisted to get a job. If you prepare very well, you might be looking for that 1 or 2 chance to get the job. Now, do you know why I still say this? You guys may not know that I still have people in Nigeria that get a job. I still have them. So it's not like they are not shortlisting people. I still want to believe that if you have done something right, they will give you that opportunity. But I must say this, that has reduced because of COVID. There's not such a thing as COVID anymore. Or maybe the effect of COVID has drastically reduced. So many people prefer face-to-face interview now. The only one that can shortlist you if you are outside UK will be someone that is willing to do virtual interview. And you don't know that one, and that is why you need to make sure you are up to date with NHS job or maybe track job. Make sure you apply for every job that you can get there. There is something else I forget to mention. I was gonna say it in the end, but I've remembered now. Another reason why they don't shortlist people is that, you know, when you are making for application, you know, that time you apply for job and they start asking you some question. You know, all those scenario questions they ask you guys, some of you guys will just gonna be answering the question. You don't know what you are answering. If you don't know what you are answering, stop. Ask somebody that knows. Please look at this. That's why I tell you, don't be in a hurry to say I've applied for 20 jobs. What does that mean? If they ask you, for example, in a case of emergency, what are you going to do? That might look simple. If you think you can answer it very well in a practical way, like someone that works in NHS, why don't you ask for friends and say, please, can you help me to answer this question? If the person can help you to answer the question, wait until the person answers that question, then you can put it there. Because that question is part of what they are looking to checking before they can shortlist you. So even if your SI is okay, and your experience is okay, but those questions they ask in between the questions, the application, if your answers are not reflecting with that thing you are saying is supporting information on your working experience, they know that you just make it up. Can I tell you guys this? I am an insider and I'm going to be honest with you. These guys know that some of the things you guys are putting in your supporting information and working experience is not true. But let's leave that for them. What you need to focus is to prove that either right or wrong. And that is where, if any question is asked and you don't know that question, for me now, I'm busy. But if you tell me something like, please, this is a question they asked me, can you help me to answer it? If I have time, I'll definitely go to say, okay, give me some time, and I'll answer it. And by the time I answer it, I bet you, if you check my answer and check the way you are going to do it, it will be different. And that thing matters a lot. Okay? Is that okay, Damilora?
Yes, sir. Thank you very much, sir.
Blessing, do you think you can unmute yourself? I think you are muted. If you can unmute yourself and ask your question, that would be great. If you are still there. If not, I think Aja, you can go ahead.
Sir, Blessing dropped our message in the chat.
What did she say, sorry?
She said, my question is, if you are not competent in validation of results, is it still possible for you to include it in your supporting information? And secondly, I was asked in an interview question saying, if an analyzer breaks down when performing tests, how will you tell the patient about this? Yes, sir.
Okay. Right. Blessing, can you confirm on the chat that you are hearing me so that I'm sure I'm answering your question, please? Just put in the chat and I can hear you so that I will know. Because if somebody asks a question, I want to answer the person's question. Have you done that? If you can hear me.
Yes, sir, she has.
Okay. Now, let me answer that question. I'm trying not to use a certain words, but I'm going to say it this way. When you are making application, don't worry so much about what you know and what you don't know. Don't worry so much about what you've done and what you've not done. Focus on making a suitable and a strong application. Your own duty is that when opportunity is given to go and prove it right.
So,
do you understand? That is what I would say. So you've not validated result, yes, but they need it. Except if you don't want the NHS job. If you need it, validation of result. If you work in Nigeria, anywhere you've worked, you've released the result, you've given patient result. That is result validation. It's just that with the way we do it are not the same way they do it here. So your own is to put it the way we do it here. I have validated result like I've mentioned, using blah, 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 and mentioned all of those things that you've done a result validation. If such a question come out, say the same thing that you have on your supporting information or your working experience, and that is the answer. Once you know laboratory information management system that are used in validation of result, you've known how to validate result. Once again, to validate result means you judge a result. Is it correct for this patient? In fact, if you go to my YouTube video, I think I've mentioned something like there are some videos I made in terms of how to validate full blood count result or how to validate coagulation result. If you play it, watch out what I was saying before, what I'm saying about the result. That is how to validate result. If you open that result to ask yourself, is this result consistent with this patient? You look at the patient history. There are things you check. After you've checked all of these things, then you can ask, okay, I'm going to release it, or I will withhold it and ask for a repeat, or I will fund the result. So any actions you take is based on your investigation, and that investigation, which is validation of result, is one of the primary responsibility of a biomedical scientist. So that's what I would say for that. And you go for an interview, they ask you, how can you let a patient know that analyzer has broken down? I'm not sure if that was a question, but what I would say that, because when a sample comes in, we don't really communicate. Okay, for example, we don't really communicate with the patient all about, but I think sometimes, even if a patient phone and say, the patient need to always refer back to his or her GP or the doctors and all of that. So it's not really the patient that you have to report to about that. Does that make sense? However, when your analyzer breaks down and you are trying to fix it and it looks like it's going to take you longer time, there's what we call medical record or whatever. Even if you don't remember medical record, there are this part of which they are the part of the hospital that can actually pass cascade informations. Are you following? So once you call them, I think that's what they are called. Once you call them and say, see, this is the situation I'm having right now. All I want is just urgent sample because I'm going to be doing something manual. They know how to communicate to the doctors and the nurses say the lab is down. I don't know if that makes sense. Okay. And that is what you can do. Another way is that if you think like your analyzer has breakdown and you are doing your best and it seems like samples are coming, GP samples are not your problem. Okay, what is not the problem is the samples coming from urgent unit, maybe something like A&E or ICU or maybe maternity ward, depending. Are you following? So you can phone them and say the analyzer is down. These are the things that I've done. Say analyzer is done, I will need only urgent sample. You'll be surprised that the sample that come from A&E will reduce because you've said, I can't do this the way you want it, it is done. That's number one. Number two, in order to facilitate, if your analyzer is down and you are trying to meet up with the services while you are trying to sort it out, I'm trying to from that answer another question. You must learn, if you are the only person, you must learn to go to, if you go to every laboratory, we have what we call core booklet or core, but basically it means that every staff, their names, where they live and their numbers are there. Are you getting me? Okay. So somebody can call and say, hi Emmanuel, please, the analyzer has broken down. I don't know, please, would you be able to come in and assist me? There's a lot of samples going on here. That needs sorting out or need validating. Does that make sense? So that communication is important. Sometimes you communicate to the manager, say, see what is going on. You know, what do you reckon? The manager might say, okay, I'm going to come in, or the manager might tell, okay, phone this person or phone, whichever way. At the end, you are trying to use your initiative to call in another member of staff to assist you. That is the approach you can use. But if it is not something there's a lot of samples, but there are few, but it is manually you are doing it, and the analyzer has breakdown, you tell the words, I only need urgent samples. And I hope I've been able to answer that question. Blessing, can you confirm? And if not, you can answer that. Okay? Right. Ajay, have you asked your question? I can't remember.
Okay, sir.
Okay.
So my voice is audible or not?
Sorry, say that again.
So is my voice is audible?
Yeah, I can hear you.
Okay, sir. Firstly, I would like to thank you to give me opportunity through this webinar. So my question is any organization or employer prefer MSc for a biomedical technician job or BSc is okay? and what they prefer experience, like 2 year, 3 year, or 4 year.
Sorry, can you repeat that question? I missed something there. Sorry.
Okay, so I repeat, my question is, any NHI organization
Yeah.
prefer MSc
Okay.
for a biomedical scientist job, or BSc is okay?
Okay, that's fine. It doesn't really matter. What that makes you a biomedical scientist is your BSc anyway, not your MSc. However, when you have MSc, it can help you to look for a higher band like band 6, as the case may be. But the ideal thing is that you're a biomedical scientist. It's not really a problem whether you have BSc or you have MSc. The only thing MSc can do is to show that you've studied more, and that can give you a leverage of asking for a higher band. Does that make sense?
Okay, sir.
Good.
Or
Right, Prince.
how much experience they prefer, 2 year or 3 year plus?
When it comes to NHS, most times, once you have gotten experience post-registration, that is what they want in most cases. That's why you hear some of them say, we need a post-registration experience, which could be 1 year, 2 years. What happens in most cases is that if it is a higher band, like band 6 or maybe band 7, they might say somebody preferably, or there's a difference between essential and desirable. So what you need to focus that, did you meet up with the essential requirements? Don't worry about the desirable. If they say that they desire 7 years experience, it's not your problem. Did you meet up with the essential? And that is what you should focus. So to answer your question, whether you have 1 year experience or you don't even have any experience, but you are HCPC registered, you just have to try your best. But whether 1 year experience, 2 years experience, it doesn't really matter. What matters is making sure that, I wouldn't say it doesn't matter like it doesn't matter. It does matter, but it shouldn't really affect you so much if you make application, broaden your applications and make sure that your applications are strong. You're always going to get that opportunity to be interviewed. Does that make sense? Yeah?
Yes, sir. Yes, sir.
Good. All right, Prince. And I think if you guys don't mind, that might be the last question I'll take. Except if there's any pressing one, then I'll take it.
Okay, sir. Thank you so much for this opportunity. I was actually told by a friend, a lady friend, about you, and trust me, going on your YouTube channel has really, really been helpful, because when I came to the UK, I didn't know anybody that could, help me through this biomedical scientist job. But watching your videos on YouTube have really broadened my mind, my scope, and has even taught me a lot more, about some of the activities, that goes on as a biomedical scientist, in the lab and all that. So once again, thank you so much. And sorry, I joined late, and so I don't know if this question has already been addressed, but I would wish if you could touch it one more time for me, please. Sometimes with the supporting information, a question sometimes pops up. Most often that relates to if you could tell us, some mistake that you've done and how you'll be able to correct that mistake if you are given the opportunity. And then secondly, if you could tell us about an example where you have acted on a feedback, to improve your performance, or change your behavior, something like that. These two questions are really, that really pops out, with most of the applications. If you could please touch on that for me. Thank you.
Okay, thank you very much. That's actually a very sensitive question. Before you see this aspect of the questions, this is actually one of the important of this. One of the things I want to do with this group is, I talk to many people and I don't have the time. So this is an opportunity to talk to many people at once, and that is what this group is all about. That's why I call it mentorship. Now that I've said this, I've told you guys, come up with any question like this one, and we'll just have a session where we're going to deliberate on it. So even if I'm answering some of these questions, if you're still not yet clear, you guys should agree on the group. Let's talk about this question, that question. The admin should be able to relay that to me. We'll find out when it is suitable, and I'm happy for us to also meet and then answer the question. Then we are focusing on that. Does that make sense? Now, to come to what you've asked, Prince, I think I have a video where I'm not sure what I titled that video, but I'm sure I've answered the question about the mistake you've done in the past, what you learned from it, and all of that. Now, this question can come in different forms. They could say, how do you correct it? What did you learn from it? And all of that. I want you to know that biomedical scientist is a profession that, in fact, let me put it this way. When they say experience in an NHS experience, let me tell you what they are talking about. NHS experience means mistakes. I know you guys don't know this, but that's what it means, mistake. It takes mistakes to have experience. I hope you guys know that, okay? So now, that is why that question comes up. Which mistake have you made? To answer such questions, you need to give example. You can't, there are questions that you can never answer by defining them or trying to talk about them. There are questions that you can only say few things and say, for example. That is the only way to answer them. So these two questions has to do for example, because that's the only way you can answer it. So the mistake, you have to now paint a scenario for them and then say what you have learned from it. Let me say the one that I've used on my previous videos, okay? I did talk about a situation whereby somebody has validated a result that has high MCHC, okay? Which that high MCHC would affect the red cell parameter. So because that has affected the result, the person have now validated the result. And once the doctor saw the result, the doctor noted that there is something wrong with this result, and then reported that thing, and it became an incident, and that member of staff was worried about it. This actually happened to me. Okay, so it's a mistake. So what did I learn from it? What I learned from, because once you are queried, then the person who is training you might not need to know, is it that you don't understand or there's a knowledge gap and all of that. But in the end, you are going to be told what to do, or you are going to be asked to write a reflective essay, or maybe a reflective, writing, just to show your experiences on that, what you would have done, and something like that. And that is where you can say that I've made so and so mistake, and what happened was this, that, and I was corrected. I now understand that when I see this kind of result, I need to do this, that, and that is what I've learned. That's how you can answer such questions. Okay. Now, number 2, which is your feedback. When they ask you these kind of questions, they want to see, is it that when somebody tells you a negative feedback, you'll be angry? No, you don't need to demonstrate that. When such a question comes, what you need to tell them, give them example where you've been given a feedback of mistake you've made and how you took it positively. You need to know that it is better in this kind of thing. It's good to say that maybe you have a positive approach with feedback, irrespective of whether it's a good feedback or negative feedback, because it depends. In most cases, it depends a mistake to be a good biomedical scientist. So irrespective of what I've been told, whether it's a negative feedback, I understand the importance to be able to learn from a senior member of colleague to be able to continue to improve and all of that. So I have a positive approach to it. Then you can give example. That's why they say give example. You can give example of any kind of feedback that has been given to you. Even if you don't have example, make one up. If you listen to my videos long, you should see a lot of problems. Make it up. Let's say something like, how will I put this? Okay, let's say something like in a situation of, I think this one happened in biochemistry. When a sample is not properly labeled, you can reject it in the laboratory. But in biochemistry, once you receive a CSF sample, even if there is a mistake in the labeling, you don't reject it like that, like saying I'm not going to run this, repeat the sample, because of the danger in collecting CSF. So people have made a mistake of rejecting the sample, saying I cannot run it, but again, that raised a lot of dust, and then the feedback the person got that you don't do it like this, you need to do it like this, as the case may be. The person cannot feel bad, you need to take it positively. Or let's say you have accepted a sample that you should not accept, or you analyze a hemolyzed result and give the result which you shouldn't give. You have made one mistake or the other. Find a mistake and mention to them and say, I made this mistake and I was giving a feedback that this is the way I should do it or not. It could even be when you are doing your, what do you call this thing, appraiser. When you are doing appraiser, you can get a negative feedback and say, okay, member of staff are saying that you are not a team worker. They can say that some people are complaining that you are not a good team player, you don't support them and all of that. Your own duty is to improve on that. You can give it to them as an example. Say, when I was told that, I thought I was, acting as a good team player, but I was told that, I'm not really acting like that because I don't communicate, maybe I don't discuss with member of staff. That I've not improved, okay, just to make sure that other colleagues will be okay working with me. That is feedback. That's your approach. Your approach has to be positive. Do you think I answered the question, Prince?
Yes, sir. Thank you so much. Thank you so much.
No worries. Okay, I think this is where we're going to stop this today. I'm going to stop by saying that, except, does anybody have any other question? Hopefully not. Okay, because if you do have any question, I'm still more than happy for you to ask in the group, and the admin will let me know about it. Of course, I can also discuss that further. Whatever thing you guys discuss in that group, I'm happy to help you guys. We can have a session to talk about it. Don't worry so much about it. Your own is to make effort. I'm sure in the end you get the information that is required. Okay, good. All right, thank you guys so much. I think I've given you guys all the advice I want to give you. All I can say that I wish you all the best. There are questions that people have asked me in the past. I have a bank questions, and one of the things I think I'm going to do when I'm free a little bit, I'm going to get those bank questions, and we'll have this kind of meetings. I will ask the questions and I'll be answering it. Hopefully you guys will also ask questions, then I'll be able to answer it as well. Okay, all right. In absence of any other thing, I will say thank you very much. One more time, is there any question? And if there's no question, thank you very much, and God bless you.